College, Tenali, AP, in association with APTI State Branch on Artificial Intelligence in Drug Discovery and Development. Myself, Amjad Ali Sheikh, Associate Professor, Department of Pharmaceutics, ASN Pharmacology, Tenali. As a part of the EFD, today's topic will be on artificial intelligence and patient safety. It takes me a great pleasure to introduce our today's resource person, Dr. Sri Harsha, M.Pharm, PG, Deep in PV, PhD, Associate Professor, Department of Pharmacy Practice, JSS College of Pharmacy, JSS Academy of Higher Education and Research, Mysore, India. Sir holds many other positions in the institute, such as Medication Safety Officer, JSS Hospital, Mysore, Deputy Coordinator, AMC and Regional Training Center, JSS Medical College and Hospitals, PVPI, Program Coordinator, OEP, Pharmacovigilance, JSS AHER, Coordinator, Pharmacointelligence and Journato Pharmacy, JSS College of Pharmacy, JSS AHER, Mysore. Dr. Sri Harsha had graduated in pharmacy and is a qualified GPAT and completed his master's in pharmacy practice with University Gold Medal. He is a recipient of Department of Science and Technologies Innovation in Science Pursuit for Inspired Research Fellowship for Doctoral Research. Dr. Sri Harsha conducted various pharmacoepidemiological studies concerning patient safety in hospital settings. For his work, he received numerous travel grants to attend and present research papers in international conferences that were held at Oman, Australia, Ireland, Canada, Paraguay, Japan, and Ras Al Khaimah. And he received 3 Best Posters Award for this. Sir has 48 publications, including one in the New England Journal of Medicine and American Heart Association's The Circulation with H and I-10 Index in each, and is certified mentor with Publons, Web of Science. Further, he has worked as a primary clinical research coordinator for COVID vaccine trials, Covishield and Covovax in India during the first and second waves of COVID-19. Currently, Dr. Harsha is working on convergence of artificial intelligence in pharmacovigilance to further strengthen the patient's safety. Welcome, sir, and I give the session to over you, sir.
Thank you, sir. Thank you for your warm welcome. Good afternoon, everyone. Am I audible?
Yes, sir, you are audible, sir.
Thank you. Now, I must seek the apologies for starting this presentation. I know that today we are having a cricket match as well at this very same hour. So, throughout my presentation, I would like to share how artificial intelligence can shape the future of pharmacy practice, especially to the pharmacy practice. So allow me to share my slides. Could you please confirm that the slides are visible?
Yes, sir, your slides are visible, sir.
Okay. Good afternoon, everyone. Welcome to the artificial intelligence and the patient safety. Now, artificial intelligence is something that is trying to mimic the natural intelligence, that is human intelligence. The artificial intelligence has many applications in the entire world, and not so far in our coming few decades, a lot of our jobs are going to be replaced by the artificial intelligence. So, in this particular change in tide, where we should stand and how we should harness the power of artificial intelligence such a way that we are secured for our jobs. So let us see into that angle. The artificial intelligence in the patient safety has come to support the most sacred oath. That is, first, do no harm. Do no harm is the first oath that all the medical students will take when they are graduating from their degree. Even if we don't do any good to the patients, that is okay. But do not harm and don't be the reason why the patient has suffered in an institution that is supposed to heal them. So, but having a lot of workload and lot of distractions and fatigue and a lot of complexities in the therapeutical regimens, you see, the distractions are everywhere. And not just that, the fatigue is also taking the toll on the healthcare professionals. Now, inculcating the artificial intelligence is going to help to ease such bottleneck scenarios and help to improve the patients to get well soon. Now, what is this patient safety that we are talking about? One part is caring for the patients, another part is caring for them safely is a major part of it. Patient safety. Patient safety is a framework of work. It is a framework and it is organized activities that creates a culture, processes, procedures, behavior, technology, and environment in the healthcare that consistently and sustainably lower the risks, reduce the occurrence of avoidable harm, and thus making the patients to recover in an holistic manner. What is happening? Do we agree to the fact that our hospitals are sincerely the safe places for all the patients? I don't think so. There is a lot of literature published around the world saying that the hospitals are fraught with even more damages than the benefits they can do. And this could be because of lots of reasons: lack of proper staffing, lack of skills, lack of the work life balance, and a lot of such things complicate the way the healthcare professionals care for their patients. Let alone forget about the patient getting healed in these kind of institutions, but they are going to affect the patients very, very badly. Now, imagine this scenario. You have gone to a mobile shop to purchase a new mobile, per se, an iPhone or a costliest phone of your dream. You have put a very hard money to purchase a mobile. And after buying a mobile, you are so excited. You came back, you started to work on phone, but on the day 2 or 3 onwards, your mobile started to give the pain for you. Of course, you may be covered with the insurance or you may be covered with the return or refund policies. But then imagine if the would you again go to that particular shop, or would you again prefer to buy that particular make and model? You would think twice, right? Now, what if the same thing happens in the hospitals? What if the same thing happens in the healthcare professionals? Would you be okay to do that? Now, thing is, if not this mobile, I would buy another mobile. I won't be damned if it is a mobile. But if it is the health, who's going to pay for that? And it is going to irreversibly break the confidence that I have on the healthcare system itself. Then where should I go? How should I fight? Bet alone, I am there first, actively and healthily to fight all these things. So, which is why the patient safety is very, very important. Today, the World Patient Day, the World Health Organization celebrates as the World Patient Safety Day. Every 4 patients in 10 are harmed in the primary and the outpatient healthcare systems. And in the countries such as developing like ours, India or Southeast Asian, you see, these numbers could be much, much more. However, we do not have any idea what is the to exact number the patients are being harmed due to the underreporting. Medical errors or the medication errors have the significant consequences on the patient safety and the quality of the care that is being provided. And these errors can occur because of many reasons, maybe a distraction or a fatigue, maybe the fragmented communication or inadequate coordination, or the workflow is not efficient where the takeover and handover of the patients is not well done. The medication reconciliations are not performed at all. And furthermore so, We have the complex healthcare systems with multiple people involved in multiple hands of the delegations, and thus the dependencies increases not just on one person but on the entire system, and that is waiting just to get collapsed on its own weight on the days or the hours to work in a day. It's not just the police department that is working 2 times a day or complete three duties in a day, but also the healthcare professionals. They do work multiple duties in a day, and working more than 70-75 hours a week could lead to something called as mental breakdown or burnout scenarios. And if they have to care for the patients during that particular scenario, that could compromise the efficiency and the quality of the care. It's not just that. Even the healthcare professionals are also human beings. That meaning they also have the families, they also have the dependent people in their homes who are waiting for their time and attention. Not just the doctors, but the ward boys, nurses, pharmacists, every one of them. And when they do not have the enough time to balance between the work and the life, you see, these things will percolate into the most outrageous possible outcomes, and those are medication errors. Now, in a study conducted in 2014, the Lancet journal has said that in India, for every 1,000 patients, there are only zero point 0.7 qualified doctors to care for. Now imagine, and the pharmacists less than 1, and then the nurses less than 1.4. With this kind of low numbers, what is the quality that you can ensure that the patients are getting the best of the care? Now, medication errors are one side of the coin. The other side of the coin, this leads to the increase in the quack doctors, increase in the quack practices, increase in the self-medication, increases in the tendencies of the antimicrobial resistance. And mark my words, it's been more than or close to 30 years that we have a newer broad spectrum antibiotic that for the meant for the regular use in the human beings. Now, where are we going towards it? What if the tigecycline, the strongest antibiotic that is available at the moment, develops or starts to show the antimicrobial resistance? Then what? We don't have any other option. Looking at the global public health issue, 1 in every 300 patients, do remember this data is from the most advanced or developed healthcare countries. So they have a reporting systems that are so robust that they cannot hide any pieces of information. However, India or Bangladesh or any other Southeast Asian countries, we do not have this kind of reporting mechanisms, and therefore, more than I dare say, 95% of the cases are gone unsupervised or unnoticed or underreported or even suppressed. Now, in the Western countries, they have 1 in every 300 chance of a patient being harmed in the hospital. And 1 in 4 patients are harmed while receiving the primary and the OPD healthcare. Now, every 14 in 100 are ending up in receiving or experiencing healthcare associated infections. This could be hospital acquired pneumonia, or this could be hospital acquired UTI, or even so, any such infections. And more so, the 16 to 17% of all the diagnostic errors, they are ending up in causing the adverse events to a tune close to 17%, and thus making the patient to suffer more, or to make the medications consume more, or even more so to experience a worsened therapeutic outcomes. And more than 40 million adverse events occur during the hospitalization. Do you know that there are as many as or up to 80 steps involved? 80 steps involved when a patient goes to a physician and gets a medication administered. Within these three coordinates, or between a patient, physician, and a nurse, you see there are 85 steps involved where the medication is being administered. And in the each step is an opportunity for a medication error to occur, and thus compromises the patient's safety. And what is the hard end part? Well, the 50% of the patient harm is preventable. Of course, there is a huge discussion, debate going on whose fault it is. Well, some say that it is the system's fault. Some say that it is the individual fault, depending upon the opportunity how these people are interpreting. But we must agree that it is both faults. It is a system as well as the individual. Only thing is they synergize each other's fallacies to worsen the patient condition or the patient care, and thus not only taking away the hard-earned money but also irreversibly affecting the moral of the patient as well as the health and the therapeutic outcomes. And it is estimated that only in the United States of America, the insurance companies pay around $19 billion a year. And the global estimate from the countries, there are only 12 countries in the entire world who have come across to tell that they are going to report and discuss the medication errors openly. And they are this is through the something called as Salamanca Declaration. Only 12 countries, and they all put together are paying a trillions of dollars in the lawsuits and in the managing the adverse outcomes and paying the compensations to the healthcare professionals and the lost productivity and other medical expenses. This is the scenario. Now, India, we know that it is a country with less than 15 to 20% of the population that is insured, and remaining 75 to 80% of them, they still have to pay their health care through the pocket expenses. Now, on top of that, we know that the amount of the medical expenses can really break the back of the a middle class family, which constitute the most of the Indian population. Now, on top of that, if any of these health or the safety issues occur to them, they have to end up in paying more money than they could possibly pay. And some unfortunate conditions, you see, these events can result in a lifelong experiences that are not at all desirable by the next person who's living to us. So, how can we stop all this? Well, we can bring into the artificial intelligence. But before we start with the artificial intelligence, let us understand the three different terminologies. The first one is digitalization. The second one is automation. The third one is artificial intelligence. However, artificial intelligence often goes with one more term called machine learning. We will come to that later. But let me start with the digitalization. In between, sir, could you please confirm that my voice is adequate and the flow and the net is fine?
Sir, I think your voice is just breaking, sir. Maybe it might be a network issue.
Okay, how long has it been?
No, sir, just for a few moments, sir, not for long.
Okay, now am I fine?
Yes, sir. Yes, sir. You're audible, sir. Clear, sir.
Thank you so much. So let us start with the digitalization. Digitalization is a process of converting anything into that is in the hard copy to the digital format. These are we are at this particular step. Automation, it is creating the software or hardware that can automatically perform certain tasks without human intervention. That is raising an indent in the hospital through hospital information systems. All these things will come into this kind of a thing. Third thing, the most evolved form of the automation is the artificial intelligence. It is a science of the making machines to think how a natural human being would think. And this is a software that can mimic the human reasoning with emotions and intelligence. Of course, machine learning, without saying, it is the heart of the artificial intelligence, and they both are not same. Now, we all know this particular step. Charles Babbage is the one who has brought into the first ever programmable computer. But very few know about this great gentleman that is Professor Alan Turing. He is the one who determined the life of the World War II and broke the Hitler's Enigma game, and thus he broke the war, turned the tide in favor of the America and Europe, and won the war with few lesser people dying. But then they have kept it as a secret because they didn't want the Hitler to know that they could break their communication system. However, only after 50 more years, they have declared that Alan Turing's mechanism is the one which was vitally helped in breaking the Hitler's or Nazis' Enigma machine, and he is considered as the father of the artificial intelligence. And in 1955, that the Dartmouth College had conducted a conference, and in that conference, they have first coined the term artificial intelligence. And in 1965, what we are using now, the chatbots. If you go to the IRCTC website, you will see a small pop-up will be coming up asking chat with our Disha or chat with our XYZ. All these are the nothing but they have drawn their simple philosophies from this particular natural language program called ELIZA. And 2022 is a year where the iRobots have launched an artificial vacuum cleaner. I mean, of course, which actually mimics a human brain by avoiding the obstacles. Sir, is the net is fine, sir?
Yes, sir, it's fine, sir.
Sorry, I could see some jets here. I'll continue, sir.
Yes, sir.
In 2022, we have the iRobot has launched the Roomba, which has an autonomous vacuum cleaner. It is designed to avoid the obstacles and suck in everything. And way back now in 2018, we have Edward created the expert systems that would emulate, something that is very similar to the how the human experts would take a decision called. You see, we have something called as Delphi techniques, wherein a series of experts will sit together to understand or to come to a narrow down by eliminating other possible choices, and they would choose what is the right thing to do. And that now it is being doing by this artificial intelligence. And by 2018, you see, the most of the universities have started to introduce the course artificial intelligence, and in India also it has started. Now, is the artificial intelligence is only permitted or only leveled only for the computer sciences and the data analytics? Not necessary. It can be also used amongst every possible profession to reduce the mundane work and go ahead and do more creative stuff while the human beings are focusing on the better of it. So Alan Turing has proposed the questions, can machines think? And this one particular statement has completely changed the way the computers are looked at it. Now the whole world is again divided into two halves, where one half are welcoming the advantages of harnessing the advantages of the artificial intelligence, whereas another half are worried about the replacement of the humanity, and also not having any emotions could lead to the, of course it could be the most logical decision process, but it could very badly or drastically can affect the outcomes of the decision making. Now, the origins of the artificial intelligence in the healthcare, as I said, that it was first coined in the Dartmouth College in 1955 following the Alan Turing's thing. Without Alan Turing, there is no artificial intelligence what we are experiencing today. But the AI applications did not enter the healthcare field until 1970s, and the research that is produced MySyn, an AI program in identifying the blood infection treatments in the early stages. And in 1979, the American Association for Artificial Intelligence was formed, and thus it is actively governing the use of AI in the day-to-day life. Now, how do we use artificial intelligence in our healthcare today? Well, artificial intelligence is basically nothing but if or but algorithm. It is just an algorithm that speaks in terms of ifs and buts. But then there are several subtypes of the AI. Now, this includes the machine learning, which I just spoke about. And this is where we are be going to talk more. And then we have something called natural language processing, like our chat GPT. And then we have the rule based expert systems, which it will tell that whether the medication that we are giving is right or wrong. And then we have the diagnosis and the treatment applications. And then we have the administrative applications that would help who has to take or who has to do something. I mean, in the administrative application in the hospitals, if we are working, we have something called as privilege committee. In this privilege committee, they will assign who is privileged to do what. For example, the senior surgeon is privileged to take up any surgery without consent. I mean, consent in the sense without consulting the other physicians or other surgeons. They can take up the surgery as and when need basis or SOS basis. They need not to really think about it. But a junior surgeon cannot do that. They have to seek the permission. Only when the permission and the table are available, then they can have the surgery done. So administrative applications, it will automatically assign for any emergency case or any emergency patient that comes into the hospital, for a surgery. So whom should be contacted, whom should be called, whom should be given the opportunity to take the deal. So privilege committees, policies are strictly enforced by using through the administrative applications. The next thing is machine learning, perhaps is the most common term of the artificial intelligence that we use in the health. Now, this is primarily used in the field of the precision medicine, where the machine is learning the types of the phenotypes of the different genetic materials, and it will try to understand, okay, which human being tries to respond most to which kind of a medication, and what should be the most optimal dose, looking at the pharmacokinetic data that is being fed into the system. And after reading around at least 500 data sets, 500 data points, the 501th data point at 95% confidence interval, the machine can tell what could be the most effective dose of a particular drug in that particular human being. Now, the second one is natural language processing systems are becoming a norm in the healthcare hospitals. Like there are 7 hospitals in the entire Asia which are paper free, meaning whatever the doctor speaks, whatever the patient speaks, or whatever the nurse says, everything gets recorded into their collar mics, and it will be automatically transcribed into a Word document. And later, once everything is done, the physician assigned would be reviewing the notes and would be making it into a final case notes of the patient. Now imagine, those patients do not have any fear of losing their health cards or health records, or they have shifted to somewhere else and they don't know where their health records have gone missing. They do not have any of that kind of a problem. And another thing is, you see, the doctors can focus more on talking to the patients rather than sitting and filling in the tons of papers or writing or raising the indents. Imagine how quickly that would be if the doctor would have thought, okay, maybe my mindset is not right today and I have missed a particular diagnosis. Let me listen to the patient conversation again. And if the if the physician calls the patient again and asks, sir, could you please tell what is your main complaint once again? What would be the confidence of the patient in that physician? It would be questionable. But if you have this kind of a system, this natural language processes, they will understand what the patient has said, and they will also tell, to what extent the patient's adjectives can be taken into. In the medical profession, there is always this thing goes. 90% of the times, this is the scenario. A patient exaggerates the symptoms. A physician underestimates or undervalues what the patient says. So there should be some balance between these two extremities, and therein the natural language processors come into the picture. So when the right set of mind is there for the physician can look back into the system and they can understand, oh, okay, the differential diagnosis could be better attained by listening to the whatever the patient has said once again. So there are some similar mechanisms, the Western world has adapted, and they are called as dictaphones. They are called as dictaphones. So these people used to speak into those dictaphones whenever they get the ideas, and they start to improvise on those ideas later when they were convenient. So now that evolved form is nothing but the natural language processing systems. Now, the last third one that we commonly use is rule based expert systems. And these things, you see, they will help us in improvising the process flow of the activity, which ward the patient should go admit, what medications the patient should receive, what are the contraindications of the patient. So when the patient has come into the hospital, the nurse is taking the blood reports, and the patient was found that okay, the serum creatinine is 2, and the estimated GFR is less than say 50 ml per minute per 1.732 meters square of the body surface area, and the doctor has prescribed a medication that certainly requires a dosage adjustment, but the doctor was not aware of the lab report and went ahead and given the complete dose for that particular drug. Then when the nurse is entering this particular drug into the system will not accept that order by saying that okay, the patient is having the GFR value low than what is anticipated. Now you cannot give the methotrexate at its full dose, so consider reducing the dose in order to align with the evidence-based medicine documentation policies of the hospital, and thereby we are reverting the damage the patient is potentially to experience had the patient received that particular medication. So these are the few of the utilizations. Now look at these websites. Ballad Health partners with the MedAware to use the artificial intelligence. Australia's Consult Note AI. These are the few of the examples. And there is one thing that I really love is the Microsoft has brought something called Empower MD. If you have YouTube, you can check this Microsoft Empower MD. This shows that how the artificial intelligence can be used to capture the essence of the patient and the physician's conversations. Now, what are the applications of the artificial intelligence in the healthcare? Well, to begin with, the first one is the artificial intelligence in the diagnostics. This is where the most of the problems are. Why do we go for the second opinion? Or sometimes you might hear that, okay, we need to take second opinion, third opinion, fourth opinion. Why would a doctor have a different opinions when the diagnostic outcomes are the same? This usually happens with the CT scan reports, MRI reports, or scans, or any other such things. Now, what if we allow the system to read how it has to be interpreted? And you see, the accuracy of the outcome could be really close, and you need not to worry or waste your time in having the second opinion. And in the Indian scenario, consulting a second opinion, it's actually a right of the patient. However, you see, it entails a lot of other, egoistic issues and the way the physicians might treat you later. All these things could compromise the confidence of the patient's caretakers as well. And they would just say that, okay, what else we can do? Let's hope for the best. So we can avoid this particular situation by using the AI in diagnostics. Second one is the AI in the medical imaging. This is the most beautiful thing at the moment our hospital is also working in. Every MRI scan that has been read through, it all usually we use the systems like Siemens or Philips in the medical devices. So you see, whenever a Philips device captures an MRI scan of a person, you see, it reads through that MRI, and the doctor would be writing what could be the possible diagnosis. The algorithm that has been fed into this particular system will also be parallelly reading on what basis did the doctor diagnose this as a hypoperfusion infarct in the right cranium in an MRI scan of a stroke patient. So, as the doctor writes the diagnosis and writes the observations, the system will also be learning through these three basic fundamentals what we have just discussed. One is the machine learning. So, as the doctor tells that, okay, this particular area is hypodense, so there could be an infarct located around the vicinity. So, the system learns that. The second thing is this, because of the way it is looking, the prognosis could be like this, or the diagnosis is this. All these things the machine will continue to learn through the natural language processes, and thus when you keep on improvising its accuracy, there will be a day the moment it reads an MRI scan or a CT scan, even without a zero margin for error, it will give you the accurate result. Such a wonderful results that even when the infract, which is in a very very small size and shape that was normally missed by a human eye, can be picked up by using the medical imaging. I just recently saw one more project that was done by the engineering students. They were using in to detect the pesticide or the pest infestation in the leaves of the tomato crops. So they kept on taking the photos of the tomato leaves and the tomatoes to early detect if there are the larvae or the eggs of the particular pests, and that could compromise the crop quality, so that they can avoid using the excessive pesticides and they can have the best harvest possible. Third, in the new drug development, you see the CAD mechanisms, what we are having, the Schrodinger software, all these things have improved the efficiencies of discovering the or designing a new molecule within a tips of the time. And the hospital information system, it supports the clinicians for the predictive analytics. Like here now at the moment we are working in our hospital to have something called as predictive analytical, so wherein a questionnaire will be developed and it is administered to the healthcare professionals. And when it has been developed and administered to the healthcare professionals, we'll understand what is their emotional status. Now we will see also paralleling how many medication errors or what are the clinical problems or what are the outcomes of this particular person in that particular OPD day. And then we will try to match the mood of the person and the outcome of the work quality. And then we know that, okay, what we should be looking at it when this person is coming. So one of the best thing is avoid or give rest or give break or reduce the workload on that particular person to minimize the untoward outcomes. So hospital information system immediately works. And another thing is, okay, one of the biggest challenges the administrators that they have is, you see, to whom we should call or to whom we should give the holiday duties or holiday rosters. That is the most painful thing, or the night duties, in such a way that giving a normal roster is not a problem. And in an untoward situation where the person is supposed to do the night duty is unable to come, then whom should we call? How should we compensate the work for this person? What if the second person that we are approaching would say that, no, I just work for the day, how can I come for the night? So how to deal with that kind of a scenarios will be helped with the hospital information systems with least amount of bias. And in the medical research, you see the preparing of the slides and identifying the metastatic cells even before the human eye or a reagent can pick up, the prowess is yet to be made very possible for the AI to look into the medical research. And also it breaks down all the data silos, where the data is kept only in one place, and it will try to integrate with the all many other systems that are connected to it and enrich itself with the accuracy, and then it gives the best possible results within a very minimum amount of turnaround time. And we have the emergency room and the surgery, and looking at the the drug therapy optimization between the epinephrine, adrenaline, and the cardiac arrest and the revival of the cardiac resuscitation, all these things. And more so the robot assisted surgeries, they are gaining their importance in the Western world. And early detection of the mental health symptoms, you see the fatigue, breakdown, burnout, all the times the humans would say that I'm just fine, it's nothing to worry, but it's not like that. And the weakness in an arm or a limb could be an early sign of the stroke that is just about to happen. All these things can be early detected by the artificial intelligence employment, and they can further reduce, you see, the untoward outcomes. The moment we detect it, immediately the next thing is start the therapy. Most of the times, the time that is taken is for establishing the right diagnosis. And we have something called as differential diagnosis, and that could be a very very complicating scenario. And when we are baffled with the differential diagnosis, the golden time would have been already passed and the patient life lives in the balance. And then we have something called as AI in the nutrition as well. Now, each person responds to a particular food or the components of the food or the nutrition of the food in a different way. So understand the person's microbiota in the gut and how does that process the food, or how efficient are the enzymes in that person's stomach. Now these are not the old days where everyone would get the same amount of the benefit from the foods what we have, but rather you see we have a lot of stress and other junk foods or pre-processed foods or refined sugars are easily available. So we have compromised the quality of our digestive systems. So there is no point even if we take the micronutrients or macronutrients, maybe we might not just respond the way we are supposed to respond. So the AI would understand the stool samples, once it assesses, okay, what kind of microorganisms are being expelled in the stool samples, or what kind of elements are there in the stool. Now, how best can we optimize the diet in such a way that the person would get the best out of the food? So that is what they are trying to do there. Visual assistance. Now, we wanted to develop an app or a device called, the third eye concept. Now we have something, 5G internet in India. Now, with such kind of a high power internet speeds, we wanted to develop a specs that would directly speak to the ears of the person who is visually challenged, and that would tell that within how much distance, what obstacle or what item or element is present. Now we have something in the Apple phones that is something called as a measure, where you can measure the distance, you can measure the length, width, all those things. Now that coupled with what is there in front of you, there is a wall in 5 meters, you may have to stop, the person would stop. There is a vehicle passing by, please stop. There is a ditch in front of you, please take a U-turn. All these simple commands could improve the quality of life for the patients who are having the visual problems. So they are nothing short of the virtual assistants as well. And another thing is we can also use these AI into making them into our personal assistants in better scheduling what we want to do for that day, feeding the work and ask them to prioritize into the considering our SWOT analysis, that strength, weakness, and opportunities and threats, and we can see how best we can put our focus instead of sitting and filling in the countless meaningless papers and wasting the time in the documentation. Imagine someone is taking care of the entire thing. Now, do you know that there is this one college that I have visited in one of these foreign countries? They have this complete biometric system where the ID card, it is something carries something called as RFID. That is, what our cars also do possess in some of the cars. So the moment a student walks into a particular hall or into the particular classroom, the attendance sensor will pick up the frequency of that RFID, and they would know that how long the student is there in the class and what time the student has left the class. And the same happens for the teachers also. The class is at 10 o'clock, and what time did the teacher come, until what time through the teacher has engaged the students, and what time they have dispersed. By looking at it, they would understand the analytics, which week of the day the classroom is full with the attendance, or which weekday of the that particular year, or which subject of that particular academic year the students were not so happy. I mean, these are surrogate markers where it will tell that okay, the students are not happy, so they are not coming, or the students are too scared and that's why they are coming too much, or what is happening. All those things can be visualized through the artificial intelligence. And lastly, we have artificial intelligence in the wearable technologies. You see, the Apple's ECG was the first ever landmark that it had. Of course, the problem with the Apple watches and the ECG, it is only done in the 3 lead ECG. Usually, if you want to have a proper ECG, you need to have 12-lead ECG. But there are cases where it has said that because of the arrhythmias that they have noticed in these Apple watches, those people were immediately sought the hospital or the medical care, and they averted a major health crisis in their lives. Now at the moment everything is on the path of the crystallization to become into the artificial intelligence aided. It is only the matter of the time that it completely evolves. Now, what is the role of AI in patient safety? The first one, as I said, that the diagnosis and the early detection. If you do the diagnosis accurately, then the chances of your medication working will be 100%. If you early detect, you see, you will be easily tackling the disease. Imagine a cancer patient getting diagnosed in the stage 1 itself, or the transition to stage 1 to stage 2 itself, over the patients who are diagnosed of the cancer in the stage 3 or unfortunately in 4. Which one is easy to treat and what is the cost that you have to pay. So AI can help us in doing all these things. And the diagnosis, yes, the problem is having a right diagnosis is always infected by something called as differential diagnosis, meaning a same disease, can, or a same set of symptoms can look like multiple diseases. Like for example, enteric fever versus malarial fever. And for our malarial fever, we need to wait at least 7 days for us to get quantitatively to tell that yes, the malarial parasite is present in the blood or not. Because you see, QBCMP, that is a common test that we use, that is quantibuffycoat malarial parasite thing. It requires at least 7 days for us to get a positive titer value. But until that 7 days, you see, you will have your total count, your leukocytes, and then your ESR values, and then the tongue coating, and then the periodic fever, chills. All those things look alike of the enteric fever to the malarial fever, but the therapies of both are extremely different, where we will focus on the anti-malarial therapy with the antiprotozoals and the altogether different set of medications. And whereas enteric fever, we have to focus on the broad spectrum powerful antibiotics. So you see, if we can establish the diagnosis, and at the earliest, we need not to worry about wasting the money or the resources for the patients, and thus the satisfaction and more importantly, the trust of the patient in the healthcare could be amazing. Predictive analysis, as I have said that. Now, high risk behavior is something we have to remember. Who are more at the risk? Who are at the risk? Like moment you say that, okay, lung cancer, the first thing we remember, smoking. Is smoking is the only reason for the high risk? Maybe the secondary smoking or the passive smoking, or work in the aromatic companies, or working in the chemical factory, asbestos industries, or working in the organic farms. All these things are the risk factors. But which of the risk factors has led the patient to develop this particular disease, is how the pharmacoepidemiology starts to look into it. Individualized pharmacoepidemiology, that is. Now, the same principle can be taken into the predictive analysis, and we know that okay, this person has worked 48 hours straight with only intermittent breaks in the hospital, that is. Now, if I give him the 72-hour work, maybe the chances of the medical mismanagement would be more in this particular person. Looking at the iris, okay, how well the iris is responding to the sunlight, or how well the light iris is responding to the, you see, the pupils are responding to the room light. You can tell that okay, what is the alertness of the particular person. Now the cars are also bringing into this kind of a mechanism, where once the person is getting into a sleepy mode, the system, the car would understand, and it would immediately start alarming, or it will slow down and slowly take the person to the other side of the road and let the driver to take rest. Now even in India, the loco pilots are now being installed with this particular AI system that could identify if the loco pilot is getting into the sleep, and then it will take the necessary precautions to put the person back in the action. So what it does ultimately, it leverages the advantage of the humanity for the benefit of the patients. Medication management. Now, it is not so possible for every healthcare professional to remember what are the side effects, contraindications, absolute and relative, that is, and then what could be the potential drug-drug interaction with the plethora of the medications that are available to us. So you see, once you feed in the patient's personal medication history, and if the person, the patient comes to the next time to your pharmacy, and you can just look into the system and know that okay, can I dispense this particular medication or not? Then the system would say, no, there is a potential major drug-drug interaction, and that could lead to adverse drug interaction, and that could compromise the patient, in a multiple ways. Then immediately the pharmacist can call the physician, and the physician can once again reconsult and find a suitable alternate for the patient. So all these things can be done by using the artificial intelligence. And the surgical assistants, of course, the UK and the Cuba are leading in the surgical assistance with the robots for their precise surgeries with the least amount of invasiveness, and also reaching to the parts of the body that are convoluted with the major blood vessels, and they are preventing two important things. That is, one is infection site, surgery site infection, and another one is major blood loss or other complication, hemodynamic complications listed in the patients while the surgery is being performed. So all these things are taken care by the surgical assistants in the with the artificial intelligence. Imagine the doctor is so good, and the surgeon is so good. The surgeon has so much of vast experience, but unfortunately the surgeon has been tested positive for the early neurodegeneration disorders such as Parkinsonism. Then what happens? The whatever the patients, you see, the particular surgeon's accuracy or the flexibility of the fingers, the person might not be able to perform with the same amount of accuracy before. So he just need not to be replaced, because that kind of a knowledge that has been amassed in the person can never turn back. So if we can have a surgical assistance, you see, the rate of the human mind, the human knowledge, and also the robot's powers can help the patient to have a successful surgery even in the most complex scenarios and get the best possible outcomes. Intelligence monitorings and the early warning systems, once again they can tell us what is happening, just as how I have discussed about the artificial intelligence in the Apple watches, and then early detection of the heart or the tachyarrhythmiasis or bradycardia in the heart, and thus making the person to just stand by. I mean, if you are having an Apple watch, you might have observed this one. They are also given with this kind of an option that would actually look at how long are you washing your hands for. If you are not washing your hands for more than 20 seconds, it will give you an alert for the healthcare professionals. So how does this know? This is what it is. We call this one as the haptic feedback mechanisms. So when we have this kind of a systems, you see, it will improve the quality of the care, and also it builds in the responsibility to the healthcare professionals. And more so, the pharmacogenomics and the personalized medications are just possible with the artificial intelligence and the machine learning. Machine learning is ultimately nothing more than, if you keep on teaching your system that 2 plus 2 equals to 5, 2 plus 2 equals to 5, your system will learn that particular thing, and then it will continue to do it will learn, and it will continue to repeat the same value output. So similarly, the more you keep feeding the diagnostic parameters and the lab parameters, and to tell that this is the diagnosis that I'm going to give, the systems will learn this. Now the more the people put the information, the more it will learn. The more it learns, the more accurate information it gives. Now pharmacogenomics, if you look at it, way back in early 2000, it used to take around 5 to 6 years for you to tell about how long it used to take like 4 to 5 years for you to have a complete gene decoded or to read the complete gene. But now if you look in the 2023, you see it hardly takes 2 to 3 days for the complete gene to be decoded, and without any gap spaces in between. And what is more beautiful, the cost has come down to a fraction of what it used to be once. And if you can feed this kind of a data, not just one person but multiple individuals, you see the efficiency of the dosing, efficiency of the drugs management, everything becomes so personalized that we need not to take extra doses, double doses, or unwanted medications that could possibly compromise the patient's health. And lastly, the clinical decision support system, just as how the surgical robotics supports are there for the physicians to understand which one is the right medication to prescribe and to what extent it should be prescribed. May I continue?
Yes, sir. Yes, sir. Please do continue, sir.
And you see the CDSs will analyze the patient data and medical history. Now in a teaching hospital, if you look at it, to care a particular patient, there are not less than 8 to 10 healthcare professionals, a senior physician, okay, that is a professor, and that professor will be supported by one associate, and that associate is supported by two assistants, and these two assistants are once again supported by the PGs, and then these PGs again the junior PG and the interns. So you see the communication between these 10 people to continue seamlessly, it is impossible all the times. But when you have a clinical decision support systems, even in the absence of a particular person in the loop, you see the best possible outcome is coming into the platform. So that is where the AI will help in having the accurate and the better clinical decisions in the patients. And then this we have already discussed, that is a natural language processing for the medical documentation. So it removes all the exaggerations or all unwanted items that does not fit into the description of a disease, and thereby it reduces the distractions in the case notes, and it will clearly help you in sorting out okay what to be focused and what to be later treated, and what is the differential diagnosis as well. So the medical documentation is one that takes a lot of time, and also most of the times we cannot read our own prescriptions, and that is because of the paucity of the time. With these NLP programs, we can overcome such kind of a problems, and we can be more accountable for our decision making process, and we can remote the patients, monitor the patients remotely by using these AI systems. And one of the systems that we envisaged and at the moment we are building into a prototype is, this is especially for the elderly patients. You see, if the patient does not open the pill box, that the intuitive pill box, that is which we are developing, continuously for more than 2 doses, if the patient misses, immediately that particular hospital emergency medical system would receive a message. EMS would receive a message that this patient did not open the pill box from the last 2 doses. Is the patient fine? Then immediately someone would call to that particular domicile, and they will try to understand if the patient is doing fine, and thereby we can avoid the elderly patients having severe complications because of their health and aging processes as such. Lastly, it also enhances the workflow efficiency because the AI knows that how many hours per week should be given for an individual, and understanding the balance between the work and the relaxation and the life as such. And therefore, it tries to see that okay, it's not just how many patients we have looked into, but how much time did we put into looking at the patient, or how many doses the nurses have administered, and how much of the other administrative work they have taken care of. So when we are trying to quantify the workload, immediately we can get a better workflow efficiency. We know that who are efficient and we know that who are not efficient, and then we can use this system to leverage the advantages. Now 2020, we have around 4.9 billion US dollars. Now today it is by 2026 we are going to have 150 billion US dollars. In just 6 years we are going to see that kind of a rate. So these are the various 10 AI applications that could change the face of the healthcare. The first one is the robot assisted surgery and virtual nursing assistants in the elderly care, or in the hospice centers, or in the dying destitute houses. And 18, this one, the administrative workflow. This is where most of the times, we will be having the standoff between the colleagues. I have done the work last night, you should do it. If you, why you only having the problem, am I not having the problem? All this kind of communications can be cut off when we can take care of AI help, and the fraud detection etc can also be improved. Now, all these are good, but what are the disadvantages? Well, the disadvantage is the data availability. As I said, that artificial intelligence is not a god, and artificial intelligence is not a wizard as well. You have to give the data, you have to teach it, all the fruits that look red are not apples, and it should be able to differentiate between an apple and a tomato. And for that to happen, you need to train your model with so many examples, with so many sizes, shapes, shade and colors of the apple and the tomato. If you do that for 1000 or 10,000 time, and then the next time, then you will might get the proper differentiation between an apple and a tomato. Now, in our country, we having the digital health records is far, it's very, very far from the long shot of realization. So having the AI, it's a something that we have to really look into. Second thing is data privacy and the security. Well, the American country is supported by something called as HIPAA law, that is a health insurance portability law that governs who have right to see, who have no right to access the data. And more so, even the Pentagon faces the hacking challenges every other day. Now think about the normal hospitals having this kind of systems. The third thing is bias. So the thing is, whoever trains or whoever writes even the algorithm of the AI, even they are also biased. If they are biased and they train the system with their biased mindset, the outcomes are also going to be the biased, and therefore it may result in something called lower than expected prediction performance, and thus complicates, it does more damage than any good. So an AI system is just as good as the person who is training it. If the person does not train it, then it ends up in becoming an absolute waste of space. The data integration. They may integrate too much of data, thinking that all this data might help the system to learn. No, we cannot do that. It is not that you throw all your medical records at the artificial intelligence and let it swallow everything, and then it does not process that way. You have to take the data, you have to clear the data, you have to clean the data in such a way that it should be able to understand what exactly it should learn, what is the importance of it. It is altogether teaching a child how to count the numbers once again. And one should have a lot of patience, and their data should be very clear. If we try to manipulate the data, it will learn the biased learning, it will have the biased learning, and it will give the biased outcomes. Clinical implementation, and once we have the AI system, and if we start, it's when you are training the system, okay, you will have a well controlled environment. But when you are implementing, it might not be like that. It's just like the clinical trials. When you are doing a clinical trial, you have a well controlled times and other patients and everything. But once the molecule comes into the real world, then the things might not be the same. So you see the clinical implementation, and the rule based expert system comes into this picture. So with whatever the artificial intelligence algorithm has learned, okay, and it will put the pop up messages to the healthcare professionals. Okay, you have diagnosed it as megaloblastic anemia, but I see the pattern that this could be macrocytic anemia. Yes, could you confirm it? If you say no, I don't confirm it, then the system, the algorithm will be forced to learn the new diagnosis how you have made. So then, and if you are not right, you see, you are teaching the system also to tell a false information. And the next one is ethical concerns. What we have, we know that it is going to replace the people, and the social concerns as well. So put together, you see, one profession that is not going to be completely or badly affected, that would be the healthcare professionals, because the patients at their last stages of the life, they would crave for the human interaction, and a machine cannot, our machine can never replace a human interaction. And therefore, yes, there is the thing. And in conclusion, by incorporating the artificial intelligence into our day-to-day practice, we can improve three important aspects. One is the satisfaction of the patient, because we have taken the utmost care in diagnosis and other things. Second one is we can reduce the wastage of the precious resources that we are having. Third one is we can improve the overall efficiency of the healthcare system. By doing so, we can do something called as want not, waste not approach into a pragmatic trajectory. So, in short, artificial intelligence, it helps and it supports the human beings to do the things without fatigue. And lastly, to say, sometimes it is the people, no one imagines anything of who do the things that no one can imagine are the ones who are going to change the face of the future. In the 19, there is this movie on Alan Turing. I know people did not, he's way too advanced for the humanity in 1950s. The humanity have driven him to commit suicide, and he committed suicide. He's a brilliant scientist because nobody understood what he is trying to do. But just because of him, what we have today is the artificial intelligence. Forget about the human beings controlling the traffic lights or planning the traffic routes using the complex statistics, or considering which part of the the government policy should receive what kind of attention. All these things are taken care by the artificial intelligence. So what humans can do? Well, they can focus on better things. They can be more creative. Artificial intelligence cannot at the moment think for itself what can be done, but artificial intelligence can learn from what we have done, and it can suggest what it would be done. Thank you.
Thank you, sir. It was a very informative session indeed, sir. I would
Thank you.
like to extend my heartfelt gratitude behalf of ASN Pharmacy College and management to Dr. Sriharsha for your valuable time for taking this session, and we thank you for accepting our invitation in your busy schedule, sir. If
Thank you,
any
sir.
queries are there, please welcome.
Doctor, I have just seen one comment from Jay Bhaskar. I'm so
Yes, sir.
sorry, I
Yes,
did
sir.
not see your message that that I was going a bit fast, because actually artificial intelligence is way too much to discuss upon, and it is way too less that we discussed. It's just scraping the tip, not even the tip of it. Oh, sir, that reminds me of one thing that I did not tell. What PharmD students or the pharmacy colleges can do about the artificial intelligence? Well, one thing, please make sure, please encourage your students and the faculties to take up a basic program called Python. Python language is the backbone of the machine learning, and there are many websites and many sources that you can learn programming through something called gamification. Um, does anyone know what is gamification? Have you ordered food on Swiggy, Zomato?
ఇంకా queries ఏ చెప్తున్నారు సార్.
May I continue, sir?
Sir, yes, sir. Do continue, sir. If there are any queries, you can answer them, sir.
Yeah, until they do that. So when you order a food, you will see how far is your Swiggy guy, how much time he would take to deliver the food to you. So you see that encourages the user engagement with the website or with the app. So there are such kind of apps that will aid in learning the Python language. And another language is R. These two are not so difficult, and it requires a practice. And you can build your own small artificial intelligence programs, algorithms, and you can feed the data, and you can, as simple as detecting or differentiating between an apple and a tomato. Right. That's all, sir.
Okay, sir. Moving on to the further session is a certificate presentation session, sir. Now, I would like to invite APTI AP State President Dr. K. Venkataramana Garu onto the stage.
Good evening. First of all, I thanks to Chief Patron of this program, Sri A. Shokumar Garu, Chairman ASL Group of Institutions, and a member of Legislative Council Assembly in Tenali Constituency, Andhra Pradesh. Patron Dr. T.V. Narayan Garu, National President, Indian Pharmaceutical Association, IPA, Mumbai. And this E-Fdp program, we are conducting the 11th September to 17th September. Today is the last day. We selected the speakers from various areas. The title of the E-Fdp program, Artificial Intelligence, Drug Discovery and Development, in association with APTA, AP State Branch. The first day speaker, 11th, Dr. R. Nagaraj Garu, Professor Sri Padmavati Mahila University, University College of Pharmaceutical Sciences, Tirupati, Andhra Pradesh. The second day speaker, Dr. Shiva Reddy, CH, Professor in Pharmacology, Illinois State University, Chicago, USA. The third day, Dr. C.H.V. Rao, National Botanical Research Institute, CSIR, Lucknow. The fourth day, Dr. K. Sushrita Garu, Professor in Department of Pharmacology, Konkun University, South Korea. Fifth day, Dr. S. Ramakrishna Garu, Senior Scientist, Indian Institute of Chemical Technology, Hyderabad, Telangana State. Sixth day, Dr. M. Murali Krishna Garu, Associate Professor, Department of Pharmaceutical Chemistry, University College of Pharmaceutical Sciences, Andhra University, Visakhapatnam. The seventh day, today program, Dr. Sri Harsha Garu, Chalsani, Assistant Professor, JSS College of Pharmacy, JSS University, Mysore. First of all, I thanks to all the 7 speakers participated in this mega event in the 11th to today, up to today, last today event. I thanks to one and all each person. My sincere thanks to on behalf of ASN Pharmacy College, myself and my team of our teachers and all members. Thanks to you, sir. Like that, our APTA office bearers of Andhra Pradesh State and our Joint Secretary of APTA AP State Branch, Srimati K. Himabindu Garu, Organizing Secretary, Sheikh Amjad Ali Garu, and technical support staff of Dr. Sai Rajesh Garu, Nandagopal Garu, and other organizing committee members of Dr. B. Sudhir Garu, Dr. T. Jyoti Bas Garu, V. Kotreddy Garu, Sai Rajesh Garu, Nagarjun Reddy Garu, and A. Samsavara Garu, and Aleke Madam Garu, and P. Bhargavi Garu. And all are supported, and along with last but not the least, Mr. Lokesh, our alumni of the SN College of Pharmacy, completed Bachelor of Pharmacy, now he is doing his Master of Pharmacy in this institution. Thanks to Mr. Lokesh. And one more person, technical support, first 1 week, Mr. Shankara Garu, electrical support, the power fluctuations ఏది లేకుండా కూడా కంప్లీట్ గా ఈ ప్రోగ్రామ్ సక్సెస్ లో వీళ్ళందరూ కూడా పార్టిసిపేట్ చేశారు. అండ్ వన్ మోర్ ఇస్ all the principals of the country, across the country, so many states faculty members are involved in the E-Fdp program. First of all, I thanks to principals and faculty members. They're conducting a mega event, FDP 1 week program. Your support is very strong. In the first time in the new area we have started in the event in the country. Generally, so many programs, FDPs in formulations, analytical or formula, so many things is conducted. But first time in a new era, new area, we have selected the topic in the artificial intelligence. So definitely this 7 days event program definitely useful to the our budding teachers and almost all in a various category, lecturer, senior lecturer, assistant professor, associate professor, professor, all are definitely helpful this particular event. I thanks to one and all. Now distribute the certificates, those who are attended in this event. The remaining already Google form already submitted all the faculty members and actively attending the first 7 days, all are received your mails certificates within short while. Thank you one and all. And and one more is the okay, one program we have to conduct. Not only the principal, not only the president of the state or whatever it may be. So definitely helpful to the all the supporting staff, teaching along with non-teaching staff. So that is the success of the program that indicates every day, every day we started at 3 to 4 o'clock like that. We fixed the program and gave the schedules to the speakers. Before that, so much exercise is necessary for the start of the program and ending after that, send the Google forms and collecting the feedbacks also. So the success of the story of the event, all the non-teaching staff of the ASN Pharmacy College wholeheartedly support this mega event. Thank you, one and all. Thank you. చేద్దాం చెప్పండి అంటే ఇది అది కూడా పెడతామా పేర్లు చదవండి మీరు ఒక్కొక్కరు మీరు చదవండి చదువుతూ ఉండండి మీరు చదువుతుండే ఇక్కడ ఇచ్చేద్దాం ఇక్కడ నుంచి ఫోటో తీస్తే
Now, now I would like to invite the participants to receive their certificates. Dr. V. Kotireddy garu. Dr. A. Sansivaraw garu. Dr. K. Sai Rajesh garu. Mrs. A. Sri Lakshmi. Panikrishna garu. N. Nandagopal Krishna. Kalyan Chakravarti garu. K. Himabindu garu. S. Alaikya garu. C. H. Valipadma garu. జే దివ్యలత గారు. టి లక్ష్మీ దుర్గా. ఏ సోని ప్రియాంక. పి భార్గవి. ఏమన్నాను సార్, లాస్ట్ టైం సార్.
షేక్ అంజద్ అలీ గారు.
Let us close this session. We are closing the session.
Now it's time to end the 7-day E-Fdp program. Thank you for being with us for the past 7 days. It was indeed an enlightening program, and thanks to all the participants who have been with us for all the 7 days. Thank you. We are ending the session. రెడీ సార్, అది కూడా పెట్టేస్తాం. సెషన్ ఎండ్ అవ్వగానే పెట్టేస్తాం. రెడీగానే ఉంది.